Welcome to the Diversity and Inclusion on Air podcast. This podcast is a program of the Association of American Veterinary Medical Colleges Diversity Matters Initiative. The podcast explores various issues related to diversity and inclusion in the veterinary profession and provides the AAVMC an opportunity to offer ongoing diversity programming to our member institutions as well as all veterinary professionals. My name is Dr. Lisa Greenhill, and I'm the Senior Director for Institutional Research and Diversity at the AAVMC. So on this episode of the podcast, I am continuing the discussion about how the pandemic, the COVID-19 pandemic, is affecting all of us. And today we're going to be talking about the pandemic, the economy, and their impact on communities of color in veterinary medicine. So since mid to late March or so of this year, 2020, for folks that will be listening to this years from now, most of the US and other countries have been under a stay-at-home order, stay-at-home orders to try to control the spread of COVID-19. So basically outside closed. We have been able to go out to buy groceries and other essentials, but for the most part, many businesses were closed. Small businesses, large businesses just couldn't go. Many office workers are working from home, as are the three of us, me and my two guests today. Unemployment hit a high not seen since the Great Depression, and many people globally have been feeling the financial pressure really closing in the longer that we are under stay-at-home exercise. So as we record this show, cities and states in the US are in the midst of phased openings. I personally just went to my first dinner outside on the patio yesterday. First time since March. It was awesome, but a little weird after so long. But, we're finding that things are starting to bounce back just a little bit. But there's some questions about who is positioned well to bounce back. So for this discussion, I'm joined by Drs. Matt Salois and Bridgette Bain, economists from the American Veterinary Medical Association. Hi.
Hi.
Great. So as is our custom on the show, I asked my guests to tell us a little bit about themselves. So Matt, we're going to start with you.
Oh, goodness. Well, thanks for having me here, Lisa. Really happy to be here with Bridgette. Yeah, just real quick, 3 words I use to describe myself as a husband, father, economist, and in that order. It kind of gives me in a nutshell. My passion is using economics to translate data into insights to make for healthier people, planet, and animals.
Awesome. And Dr. Bain.
Yeah, so my name is Bridgette Bain, as Lisa said, and I am an economist with the American Veterinary Medical Association. I'm really excited to be here to discuss these really critical, timely topics with you. I've been with the AVMA since 2013, so this is really new for me, as it is for everyone, but it's good to be here.
Thank you both. I'm delighted to have you both on the show. You all are the yings to my yangs. Organizationally, we spend a lot of time chatting together about all kinds of data. And so it's great to have you here. So why don't we dive right in? So Matt, how would you currently characterize the economy?
Well, my favorite analogy has been right now, what's happened to our economy is like what happens when you put pineapple on a pizza. It just kind of gets ruined. Sorry for all those that like pineapple on your pizza, but it's not for me. I think we're starting to come out of that. But basically what happened, and Bridgette can add more context to it for sure, is, things came to a grinding halt. Activity, grocery may have maintained, and we definitely saw some huge increases there as people were stockpiling, but entertainment, travel, health, beauty, food and service food activities, they just all came to a grinding halt. And with that, as I'm sure you and your listeners have been tracking the unemployment numbers, 40 million plus Americans, 1 in 4 households facing decreases in income and unemployment, and it's just something we haven't seen outside of wartime. And so we are seeing some more positive signs. We can certainly talk more about that, but that's been the immediate impact. It's been very much outside textbook economics.
So yeah, we were talking about that a few weeks ago as we were discussing doing this show, and both of you said, yeah, we don't, this is different. This is in the book.
For sure.
So Bridgette, what does some of this mean, at least for the profession, big picture, big landscape?
You know, I was looking at the news the last couple of days, and it's so alarming that when we look at year-over-year decrease in personal consumption expenditure, it's down 21.6%. And 21.6% may sound all right, that's still less than a third. But when we look at the fact that GDP is 70% of consumer spending, and we're down 21% over last year, it's really alarming. And to put that into context, veterinary services is a part of personal consumption expenditure, right? Most households spend at the veterinarian from disposable income. So it's a cycle that we have to figure out how we're gonna get out of, because now that we have people that are spending less, we have employers, they can't employ people because nobody's purchasing in their stores. So now people are unemployed, as Matt just alluded to. And it's just a vicious cycle. And I think that we will definitely not escape this in the veterinary profession. We will feel the brunt of it. We're not immune, as is the rest of the economy and other business owners.
Yeah. I mean, it's, you know, veterinary practices largely stayed open during this time. As an essential service, but I can only imagine that the caseload was down.
Yeah.
Any idea, any stats, any data on just how much, maybe?
Yeah, we've got some good data. EVMA did a survey. We had over 2,000 practices respond to that. You're gonna get a pulse of what April and May. And one of the best sources I go to is the Vet Success Industry Tracker on their website. And you could see, you know, starting March 15th is where things started to fall off the mountain, and continued to bottom out until around the end of March, early April, where nationally things on average were down about 20%. Year over year, revenue was down 20%, and invoices, which is probably the best proxy for visits that we've got, was also down similarly. Since then, we've kind of been in recovery mode, which is really good. You kind of this sharp down, not quite a sharp recovery, but close enough to it where nationally we are back in positive territory, seeing some year over year positives versus revenue this time last year. But there's just a great variability in where how that recovery looks across states. Things are, I think, roaring is the right term in Texas. If you look at Texas, their revenue gains are stronger than what they were pre-COVID right now. But New York, on the other hand, is still struggling. They haven't quite hit that recovery mode yet. So there's a great variability. I think we're going to continue to see that for the next several months.
So while downturns in the economy certainly affect everyone, and this one has touched everyone, right? When you can only pretty much go to the grocery store and home, that's it. I mean, parks are even closed in some places, right? So it affects everyone. But let's talk a little bit about, you know, populations for whom downturns are especially problematic. There are certainly some really high risk populations that, you know, a time like this that is kind of a once in a whatever, once in a century, once in, you know, kind of thing. It really has a major impact on some communities. So, you know, Matt, what do you have to say? Who's hurting the most? Not that this is the hurt.
and let's hope this is a once in a century thing, right? But we don't know. That's what's so uncertain, and I think where a lot of concern is that this doesn't necessarily. There's nothing to say that this isn't a once in 100 year thing. There are vulnerable populations out there. And if you look at the distribution of poverty, areas that lack access to transportation, areas that have crowded housing, areas with poor accessibility to healthcare, the Centers for Disease Control, the CDC, publishes a social vulnerability index, which they have geocoded, and you can map that and look at that across different zip codes and counties, and it shows you on a scale from 0 to 1 those areas that are socially vulnerable because of these types of factors, and we have to protect these vulnerable populations. You know, minorities, people of color, that they are at risk. And you look at the distribution of population demographics, and like close to home here in the Chicago area, you look at the share of the population that's Black or a minority, and you look at the share of COVID cases and COVID deaths. I mean, there's a clear skewness here, right? And I think that just underscores, if we didn't understand, and I think we should have understand that there were health inequalities socially, we're certainly painfully aware of those right now. And so it's taking the extra measures to ensure that there's a safety net in place to help support those vulnerable populations.
Yeah. So we often see a lot of these kinds of things in really just super inner cities, right? Like when we talk about Chicago, DC, New York, Seattle, where there are larger populations, larger diverse populations. Do we see these kinds of patterns also in rural areas? I mean, we know that it's hard, some areas in terms of the distribution of the veterinary workforce, sometimes harder to get folks to go into rural practice, but just because of the economics. Mm-hmm. So.
We do. I mean, these trends transcend geographic location, I think. And in some ways they're more endemic to rural areas. When you look at the time spread of COVID-19, since it's can't come into our lives, a lot of the heavy urban areas, densely populated. I mean, this is close to home for Bridgette in New York. They were hit kind of first. They were hit hard. We've started to see the rural creep of that right now. I think that's kind of been going on the last few weeks. And there is going to be an impact there. And that impact is going to be different than in the urban areas. I mean, it's no surprise that, the citizens of Palo Alto can respond to COVID-19 in ways that Panhandle of Oklahoma cannot because of accessibility and transportation and so forth.
Good points. So let's talk about our students, and then we'll maybe talk a bit about some other kinds of larger practice issues. So for applicants that are coming into vet school, it's probably not very well known that, about 44% or so this year really have had to rely heavily on student aid, so student loans, to get through undergrad, right? So those individuals are coming in. I mean, yeah, so that means that's, nearly 60 or 65-ish% of applicants actually are coming to vet school with zero debt, right? They're reporting zero debt. A lot of families are helping out, and, folks are really kind of grinding it out financially for those undergrad degrees. But about 40% are really quite indebted. They're coming in with an average of about $32,000 to $33,000 in undergraduate student aid debt, right? So, and those folks tend to be from the cities, from rural areas. They are coming from economically depressed backgrounds more often. And just for the record, that's about 28% of the of our applicant population are coming from low income backgrounds. And so we got this group of students, they're coming in already kind of with some debt, right? And we spend a lot of time in the profession talking about debt load at the time of graduation from our programs. Bridgette, what's happening? So, Bridgette, you do the senior survey and you look at those, some of those gigantic numbers that students are reporting that they're anticipating at the time of graduation. What does the current economy mean for them?
Yeah, I think that when we look historically at the students' debt load, we have a percentage of students that graduate with debt in excess of what it costs to graduate. And what we've determined is that there are life happens situations, like you so nicely put it, that they're not just financing tuition and cost of living, but they're financing life that they need to prepare for, and then just in addition to that, a lack of information and financial acumen, business acumen, and I've had students tell me that, I'm taking extra, so in case I need to repay it, then I have it. And I'm like, no, this is accumulating interest and this is unnecessary to save your loans. But certainly I think that students coming from more urban areas, they would definitely need to really amp up on those debt levels, because perhaps parents that might have been willing and able to help them prior to COVID are, stripped of the ability to do that now. So I think that students will definitely take the brunt of this. As we were talking about rural and urban areas, people were asking me like, why is New York so bad? My sister and my mom is asking me, and I'm like, well, more than half of the population of New York State live in less than 1% of the physical area. It's insane, right? So, you have students that they're living with their parents and grandparents, and they're, if they get sick, that's money that needs to go out the door. So you have all these factors that are stacked against them. And I think we will definitely see an increase in the amount of debt that students have in excess of tuition because of all these COVID-related factors, for sure.
Yes, yes. So next year, so everybody that's listening, when Bridget and Matt release their data for, graduating debt loads for 2021, just know that that we're probably going to expect those numbers to be quite high for some of them, right? In an informal student check-in survey that I did last month, we found that 28% of survey participants indicated that they were experiencing serious financial strain during this time, having some of them went back home, some of them are stuck on campus. I mean, there was a percentage, 18%, that said that they didn't even have stable internet. And so oftentimes we're like, oh, but everybody, if you've got a phone, who wants to go to school on their phone for 8 hours a day? And that might be their only real substantive tool, right? And so, and then in some areas, certainly rural areas, I think that folks forget that about 1 in 4 Americans actually don't have reliable internet access anyway, right? And so, folks can be afraid of 5G, but some folks have 1G. And so yeah, I think that we're going to see heightened debt loads. And so, what does this really mean for, incoming vet students that are starting this fall, some of whom may be on campus, some might not be on campus, some might go to campus, leave campus early. The landscape for what fall semesters is still very, very much undecided at a lot of institutions. And so, what does this mean? Because you actually have to have a place to live and like outside of, being on campus. Matt?
Yeah, I think it means we don't know the answer to what it means. Let's be humble, right? We're dealing with the most uncertain environment of our lifetimes, I think. And so I think, any advice, if that's what we can even call it right now, is to be as nimble as possible, financially, socially, and in other areas of our lives. And this goes the same for, student debt and decisions that you make as a student, which they're one of the most important decisions that you make in your life that unfolds the future for you forever. And we know through various surveys, that the Merck well-being, that what's driving some of the well-being issues we're seeing. What comes to the top is student debt, overwhelming levels of debt, and it's the need to ensure that we're not over leveraging ourselves as individuals in that process. It's always been the case, and now more than ever, you serve yourself by being well informed. So understand the cost of an education, understand the return on investment in that education, and make sure that you are okay with what that looks like. And it comes down to having a plan, I think, as well. How are you going to accommodate that debt? I've joked, no one at 8 years old dreams of being an economist. Just you don't see that. But this is one of those very unique and interesting professions that you do. You have these dreams from a very early age, that I think in many ways are bigger dreams than a child has of being, a heart surgeon, because it's just the connectivity that we have with animals. It's so powerful at a very young age. And you do get that. You get this desire to be in this profession more than anything. And you've told me, Lisa, some of the absurd answers that you've gotten on some of your surveys. How much are you willing to pay? Well, millions of dollars, or maybe billions now. I don't know with inflation. Let's hope not. But I think what we need is to, have these conversations, provide the information that creates that transparency so that everyone has the information they need to make the choices that they have to make.
Yeah. So what are some of the ways that the current state of things may disproportionately impact veterinarians and clients from underrepresented or marginalized backgrounds? Bridgette, want to comment?
Yeah, I mean, for sure. Certainly, there are so many issues that disproportionately affect underrepresented minorities and folks from marginalized backgrounds, not just in veterinary medicine, but that certainly it spills over. Certainly, I think that folks that are in close housing areas, in city areas and in urban areas, they are at such higher risk just because it's so much more difficult to, to social distance when you live with, 3 generations in one apartment. And so, the impact and the expense is so much higher for these folks. We've seen historically that a lot of the large proportion of spending at the veterinarian typically comes from, there's 2 factors. We look at the relationship that folks have with their pet, whether they see them as, family or property, and as well as the disposable income. So to a large degree, folks who already could not afford veterinary care will be even more at risk for not being able to access care. But we do still have a large population that are able to spend just because they can afford it. But when we do look at minorities and underrepresented groups, they are certainly at a larger risk. If you're making a decision between food, groceries, and veterinary care, that decision is pretty clear, And so I think, we really have to get creative as a profession and understand the needs of the society that we serve. It can be an ethical issue, right? It's a matter of who deserves care versus who can afford care, and that's kind of a tough thing to straddle, a line to straddle. But I think it'll certainly impact underrepresented communities, as has so many issues with healthcare and jobs and unemployment and so many things. It will be a serious impact, but it's really a great opportunity for the profession to get creative and to figure out how they can best serve everyone who needs pet care and can't access it.
Yeah, so I mean, we've seen, I tell people all the time that necessity and crisis are the mothers, are the parents of invention, right? And so we're seeing some really cool things with telemedicine. I had my dog Barkley, the famous Barkley, like his teeth were clean. Fortunately, he was, he's less than 10 pounds. So I handed him through the window. I handed him through the window to get his teeth cleaned last month. And so, those are certainly things that we can do, but, it's a little concerning. And we did a show a few months ago with Amanda Bates from North Carolina State University on job hunting during the pandemic, and how, new grads largely seem to have had their jobs in place, and there don't seem to have been a lot of offers rescinded at this time. But, what does next year look like? And for folks that want to start a practice, I'm guessing this is probably not the best time to do that. I don't know, economists.
So recovery is going to take some time.
Of silence, right?
Let's take a deep breath. It's going to be individual and regionally specific. I think you really have to look at your circumstances. We can't, I would avoid making a blanket, whether or not it's a good idea. But I will say recovery is going to take quite a bit of time, because even if the economy recovers, according to the major macro indicators, there's going to be some disruptions in the microfibers of our economy that are going to take months, if not years, to recover. We don't know what the long run implications are of 40 million people that have just lost their jobs. We just don't know. And while we'd like, and we do suspect a lot of them will get them back, we know that many of them will not. Small businesses, entrepreneurial areas are at risk. And it has been the entrepreneur that's been a driver of a captain of industry and a driver of economic activity in our economy for decades. And so we just don't know. I think what we can do is prepare ourselves for inevitable recovery, and there will be some small wins, some quick wins, low hanging fruit that I think we can achieve by getting businesses reopened, jobs back into the job coffers, so to speak. But some of these other impacts that will have ripple effects, I think we've got to prepare ourselves. It's going to be some time before things become the new normal that they are going to be.
Wow. You're such a beacon of light, Matt.
Well, there's they don't call economics a dismal science for a reason, right? But the encouraging news is recovery will happen. You look at the history of economic downturns. This is unlike any other downturn in a really important way. This is driven by an event, like a natural disaster. In fact, this is like a natural disaster. What makes this wholly unique is that this is a global natural disaster that's happening everywhere all at once. Usually it's regionalized through a tsunami, a major hurricane event, earthquake, something like that. But this is a virus that's affected people everywhere. And so there's a bit of uniqueness to that. The encouraging news with event-driven downturns is they tend to be, they tend to recover more quickly. They're not as long lasting. They're not tied to the economic fundamentals. Like the 2001 recession was, basically a bust of the dot-com bubble. And for lack of a dissertation on the 2008 recession, it was a subprime mortgage and housing. And so there were some disruptions in the economic fundamentals in the economy that caused that. But for all intents and purposes, not that there weren't weak spots in our economy pre-COVID, but the major indicators were saying we were doing good. We were not anywhere near close to a recession, maybe at least a couple of years or so off from it. So I think that's encouraging. We were strong before. Our economy is still strong. We're still resilient. The veterinary profession is resilient. I think there's strong hope for that recovery to come.
So for those of us who are not economists, is this a recession or a depression, or have we named it? Is it the bottom fell out and 2020 continues to just plague us? What do we call this period?
This was the question I asked Bridgette almost every time we had a meeting the first few weeks. What do you think? What are we going to call this, right?
Yeah, I don't know what we call this. We've never seen this before. That's what we call this. I mean, it's funny when you look at the unemployment chart, it's stable. And then there's this crazy dive and you're like, oh my God, if you look back 75 years, you cannot see something that compares to the uninsurance claims that has been made during this short period of time. I don't know what we call it, but I don't want to call it back again. I wish this is the last time it appears.
So the technical definition of a recession, I believe, and I may embarrass myself for those that have an economics textbook in front of them, but is 2 consecutive quarters of decreases in economic activity. And, this is the funny thing about economics. I think one of the headlines in the news yesterday was economists say we are in a recession. And my wife looked at me and said, I thought you already said we were in a recession. How is this breaking news? And so, we like to tell people things when they already know them. That's sort of the joke about economics. But yeah, I think this is a recession. I would hesitate to call it a depression for the very reasons that I kind of spelled out before, is that this isn't tied right now to the fundamentals, not yet. I think that's why we need to make sure that we've got the appropriate policies in place, the appropriate economic safety nets for small businesses and households, like we did with the CARES Act and forthcoming ones, to make sure that they're solvent and can weather the storm, because that's what this is.
Okay. So just a couple last questions. Any advice? I mean, you said have a plan, students have a plan, professionals have a plan, but we also know that most folks, at least here in the States, are 1 to 2 paychecks away from utter disaster, and we're past that 1 to 2 paychecks,
Mhm.
right? So what's any uplifting advice for these folks?
Yeah, yes, there is. I would say, I think we've seen the worst of this right now. We are talking about potential resurgences in the fall and late summer. We don't know what that quite means yet, or even if that will come to be. But states are reopening. The good news in the latest employment numbers is that some jobs were coming back to the economy. And I think that was a sign of people being put back to work. And so I think there is great cause for optimism there, but it's the cautious optimism, right? Like let's proceed very, very carefully here. I think the advice for veterinary practices and small businesses generally is clear. Is that I think we've gotten through the stage where there was a need to be resilient in the crisis, and we're trying our best right now to return to what we want to call the new normal or the next normal, or what we thought was once normal. The opportunity here is to reimagine what that next normal looks like, because we've had this discontinuous shift in institutions and in companies and in this relationship between businesses and consumers. And I think it was McKinsey and Company that positioned this new economy as the contactless economy. So even if we do reopen, and encouraging news like going outside to eat on the patio of a favorite restaurant, as we continue various phases of reopening, there's still going to be some hesitation until we're comfortable. And I think it's this opportunity to partner with your clients, partner with your customers to reimagine how you provide your services as a veterinary practice, as a restaurant, as any business, to make sure that you understand what their needs are, and to provide those needs and still contribute value to that client relationship.
Yeah, Bridgette, do you have any?
Yeah, I'm a bit biased as an economist, but I think it's so crucial to have a budget. I think it's so crucial as a business owner to not be scared of your profit and loss statement and your balance sheet, to understand what your numbers look like. I read somewhere that the average American spends $1.2 for every $1 they earn. That's a problem, right? You don't want to spend more than you earn. I think now more than ever, we've been taught an incredible lesson, whether we wanted to be in class or not, that it's really crucial that you prepare for times like this. We cannot foresee every single thing that'll hit the economy. As much as we want to look at the news and try to determine the impact on the markets, some things just hit your shores and you have to be ready. So I think, don't hide from the numbers. As much as you can bear it, I think it's critical to understand a budget, know what you owe, know what you make, know what you will owe, make a plan. As Matt said, I think it's critical. I really am a huge advocate of practice owners and other veterinarians just understanding their transactions, what they produce in a week, in a month, in a quarter. It's critical, it's crucial. You can't have good medicine without good business, and you can't have a healthy lifestyle without having good financial practices. There's so much research that shows that it's tied to mental health. Definitely, I think now more than ever, it's important to make a plan and figure out your numbers, figure out what it costs for you to live, and be very judicious about it.
So I feel both seen and dragged a little bit because of the number of Amazon boxes that are currently coming to my house. I think there's been a lot of that 0.2 that's over that point, the 1.2. Yeah, I mean, I think pandemic spending, there are a lot of sectors that have done just horribly, clearly. I mean, there's, folks are closing and small businesses and yet there seems to be 87 Amazon boxes between my daughter and I coming to the house on a regular basis. So I'm silently hearing, don't do that. Shame on me. So keep spending, spend within your means, live within your means.
Yes.
Great advice. So any predictions after, which is a strange way to end, given both of you have said we don't really know what's going to happen next. And, there's always all of these fun and yet somehow predictive memes of like, okay, well, are the locusts coming next? Versus the, you know, the mad hornets or whatever it was, the killer bees or something. But, you know, what are the predictions for the rest of 2020?
Yeah, I think a few things. I think we'll continue to see the states begin their reopening. I think we'll see consumers in general be cautious, but eager to return to what they called normal before, wanting to, you know, from eating in restaurants to watching a movie, to taking a walk in public places like a mall, for example. I think the prediction is it's going to look a little bit different, though. I think we'll need to get used to seeing people in face masks and need to be okay with that. Potentially, we may be seeing, you know, temperature checks on flights before you board. We may see the emergence of disposable menus because of the health risks with that. You know, I think we will get to a place of where we're better and where we're more comfortable, and because our economy is resilient, it's shown that nationally and globally. But I think the prediction is just be ready for things to be a little bit different for a little bit longer.
Yeah.
I was really encouraged to learn. I heard a veterinarian say that, you know, the profession has embraced telemedicine more in the last 30, 60 days than they have in the last 30 years. So I think, you know, it's certainly not all bad. When you look at the trends of GDP over the last 100 years, it's trending upward. So, you know, we always come out of, you know, whatever we face. And I think people will come out stronger. They will figure out what was the new normal, what works. As you mentioned, that need is the mother of innovation and invention. So I think we'll figure it out. I don't think we should be discouraged. I think we should be cautious. And as Matt says, the new normal will look really different than what we're used to. But certainly, I think we can be hopeful that, you know, if it takes us a year, 5 years, or 10 years, we will emerge and we will be producing well again.
Awesome. That, I think, is a great place to end, with a nice kind of upbeat, predictive. Don't you love economists, folks, listeners?
That was, hey, Lisa, I thought that was pretty upbeat, right? For economy, right?
Well, thank you both for joining me to talk about the pandemic and the economy. I've learned a lot, and I also still got a notification about an Amazon package that will be arriving. Try to hold the line a little bit on that. So this has been another episode of the Diversity and Inclusion on Air podcast. My guests, again, thank you so much for being on the show. Be sure to subscribe to the show on your favorite podcast app, and be sure to like the podcast Facebook page, which is called AAVMC's Diversity and Inclusion on Air podcast. So with that, I will bid you adieu. Thanks for listening.
Thank you so much.
Thanks, Lisa.